afternoon. Lieutenant Colonel Christopher Powe with the COVID-19 Task Force. Today we'll talk about the new vaccine that's being deployed via the health department, the Pfizer COVID-19 vaccine. As you know, we're 1 week into providing immunizations for our medics with the Moderna COVID-19 vaccine. We've been notified by the Department of Health that a plan is being implemented to begin distributing and administering the Pfizer COVID-19 vaccine as early as next week. So we wanted to provide you some just-in-time training with specifics on the Pfizer COVID-19 vaccine, including storage, handling, administration, dosing, and of course, adverse reactions and contraindications. Let's begin. So one of the important physical features of the Pfizer vaccine is it requires ultra-low cooling, both after production, during shipping, and at the distribution point. So we'll talk about those. The Pfizer vaccine actually arrives in cartons. The vaccine comes in multiple dose vials that arrive in what's called thermal containers to keep it ultra cooled. Those thermal containers also are bathed in dry ice to keep very, very ultra cool temperatures. And we're talking temperatures requirements in ranges of negative 112 degrees Fahrenheit to negative 76 degrees Fahrenheit. So very cold. The vials must be kept frozen in these cartons until they're thawed and ready to use. If ultra cooling refrigerators and freezers are not available, there is a temporary icing procedure that can be done to keep the product at the appropriate temperatures. If you continue to bathe the product in dry ice, you can temporarily keep the product at this ideal temperature of negative 112 degrees Fahrenheit to negative 76 degrees Fahrenheit. This is important to keep in mind because you're going to see the product come out to the sites where you're administering, and they're not going to be in an ultra cool setting. So dry ice is a key important factor in that. And also we'll talk about the time period between thawing and the short period you have to administer the medication. So you do have to thaw and store undiluted vials in the refrigerator. And those are our normal temperatures that we expect, and they're typically between 35 degrees Fahrenheit up to 46 degrees Fahrenheit. They can be stored, thawed up to 5 days or 120 hours. A carton, which is 25 vials or 195 vials, may take up to 2 or 3 hours respectively to thaw in the refrigerator. So whereas a few number of vials will thaw in, of course, less time. So the lesson is the more vials you have that are thawing in the same refrigerator, it's going to take a little more time for those to thaw out. So thawed at room temperature. For immediate use, thawed undiluted vials at room temperature up to about 77 degrees for 30 minutes. Thawed vials can then be handled in room-like conditions, and vials must reach room temperature for diluting. We're going to talk about diluting here in just a minute, but we're going to actually have to add the suspension and then mix it up on our own. And then finally, the undiluted vials may be stored at room temperature for no more than 2 hours. Finally, let's talk about vials after dilution. So after diluting, you can store a vial at 35 to 77 degrees Fahrenheit and use within 6 hours from the time of dilution. So let's repeat that again. So you have 6 hours from the time of diluting each vial, and you need to use that within 6 hours or you'll have to discard it. During storage, minimize exposure to room light because it is sensitive to room light, and avoid exposure to direct sunlight and ultraviolet light. Any vaccine remaining in vials must be discarded after 6 hours, and it's not able to be refrozen. So please do not refreeze unused dosing. I do want to mention that there's a small amount of a dose and it's not enough to get in a vial. You don't want to mix vials to create a full dose. Just go ahead and discard those. That's the safest and recommended practice by the FDA and the manufacturer. Dosing and scheduling. So the Pfizer BioNTech COVID-19 vaccine is again administered intramuscularly, similar to the Moderna, and it's in a series of 2 doses that are 3 weeks apart. Now the difference is the dosing. The dosing is going to be 0.3 milliliters or cc's per dose. Recall the Moderna is 0.5. So it's very important to remember dosing and ensure you're administering the correct product. Again, let's repeat. Pfizer is going to be 0.3 cc's or milliliters, and the Moderna is going to be 0.5 milliliters. Both are a series of 2 doses. The Pfizer is again 3 weeks apart between dose 1 and dose 2, and the Moderna is going to be 30 days between dose 1 and dose 2. So now let's talk about diluting. There will be a diluent that comes with each package. So let's talk about that. So prior to dilution, the Pfizer vaccine has a multi-dose vial that contains a volume of 0.45 milliliters and is supplied as a frozen suspension that does not contain any preservative. And each of these vials must be thawed and diluted prior to administering to any patients, of course. So let's talk about how to get that. So to dilute it, we're going to dilute this vial contents using 1.8 milliliters of 0.9 sodium chloride injection or normal saline. So we're going to administer 1.8 cc's of normal saline into each vial. This is going to form the Pfizer COVID-19 vaccine. Remember, only normal saline or 0.9% sodium chloride injection can be used as the diluent. The diluent is not packaged with the vaccine and it must be sourced separately. I suspect that the health department will provide these and provide further instruction on site as we begin to administer these vaccines. Do not use bacteriostatic 0.9% sodium chloride or any other diluent. Do not add more than 1.8 cc's to the vial that has 0.5 milliliters of the frozen suspension. After dilution, one vial then contains 6 doses of 0.3 milliliters of a vaccine. The vial labels and cartons may state that after dilution, a vial contains 5 doses of 0.3 cc's each. And this information is, of course, in a fact sheet regarding the number of doses per vial. And as we've learned, this is truly variable. We're not experiencing that right now with the Moderna, and it's not standard or consistent, and we may experience that as well too. So I guess the most important thing is to remember every dose that you give to each patient has to be 0.3 cc's per dose. Go step by step through the process. First, let's talk about thawing prior to dilution. So we want to allow thawing to occur really no more than 2 hours at room temperature, and it should be ready to be administered. Remember, those cold storage requirements have to be as low as negative 112 degrees Fahrenheit to negative 76 degrees Fahrenheit en route until we begin the thawing process. Secondly, before dilution, you want to invert the vaccine vial gently about 10 times. Now, this is different than the Moderna. If you remember, we learned that the Moderna, we're going to have a swirling motion about 10 times. For this diluent, we're actually going to gently invert 10 times for the vial. So different motions, but we certainly don't want to have a shaking motion where it'll disturb and disrupt some of the suspension. You also want to inspect the liquid in the vial prior to dilution. This liquid should be white to off-white suspension, very similar to the Moderna, and it should be opaque and amorphous particles, meaning you don't see any particles in there. And if you see some particulate matter and you can't resolve that by the swirling motion or inverting, then you should discard the vial and report that to the Department of Health staff. Also, don't use if the liquid is discolored or you see these particles that we just described. Now that we have inverted the diluent, let's add now and dilute the product itself. So obtain the 0.9 normal saline injection. Using aseptic technique, you're going to add 1.8 cc's to the vial. Prior to doing that, you want to cleanse the top just like we were learned using an alcohol prep. We also want to make sure that the needle is very small. Don't get an 18 gauge. It's recommended at a 22 or lower, smaller gauge, so like 22, 24 is ideal. Once you've added that 1.8 cc's into the vial, it's also important that we want to equalize the pressure in there. So what I would suggest doing, and the recommended manufacturer training for this is actually once you inject the 1.8 cc's, invert it and then withdraw 1.8 cc's of air out of the vial. This will produce an equalizing pressure within the vial and make it easily accessible when you were withdrawing multiple doses. So again, gently invert the vial containing the diluent now that you've made. And again, you want to gently invert it at least 10 times so you get that particulate matter diluted and also the product diluted. Finally, you want to record the date and time of dilution on the bottle. Actually, there's a space on the label that you can do that. It says dilution date and time, and that's when you certainly want to put that on there. And of course, you store it at 35 to 77 degrees after you've diluted it. And as I said again earlier, do not reuse any daily doses. You want to discard any unused vaccines when you reach the 6-hour mark after initial dilution. So finally, we'll talk about administration. Not much different than the Moderna, however, the volume is different, of course. So again, withdraw the dose. You want to withdraw 0.3 milliliters from the vial. We're going to administer this again in the deltoid muscle. So this is going to be intramuscular. Again, the same anatomical markings using 3 finger breaths above the deltoid and below the acromion process. And we want to inject directly into the muscle. Of course, the needle recommendation size, it begins at 22 and 24. Nothing larger than a 22, certainly a 20 gauge or an 18 gauge needle are going to be too large for administration. So after each dose of the 0.3 cc vaccination is given to the patient, if there is an amount of the vaccine remaining in the vial that's less than 0.3, do not mix multi-dose vials. We're going to discard those. And also, you may hear this term, do not pool excess vaccine from multiple vials. So that's sort of the lessons for that. Let's talk about contraindications and we'll be finished here. You certainly don't want to administer Pfizer vaccines to individuals with a known history of severe allergic reactions like anaphylaxis to any component of the vaccine. So what we're hearing and what we know now that there's millions of doses out there, there have been a few cases, less than 5, of true anaphylaxis to the dose. Most of these patients know that they have anaphylaxis. They do carry an EpiPen. The recommendation is at the vetting process. These people who have anaphylaxis, a history of anaphylaxis, and carry EpiPens routinely should not get the vaccine at the site. They should be referred to their primary care provider, have a discussion with their physician, and that should be given under more controlled situations like an emergency department or a clinic that's staffed to manage anaphylaxis. So that's a review of the Pfizer vaccine and mainly just the high points. So number one, remember the dosing is different than Moderna. It's going to be 0.3 cc's per dose. The site is the same intramuscularly. We'll still use aseptic technique. It does come in a multi-dose vial. We do not want to save any vials, and once you've diluted those vials, you have 6 hours at room temperature to administer the full vial, or they should be discarded. Another unique feature is that we're going to use diluent, only normal saline, not bacteriostatic, but injectable normal saline, by adding 1.8 cc's to each vial to the existing 0.45 milliliters of the diluent. And so once we mix this together, we should have about 6 doses in a vial of 0.3 cc's each. As far as contraindications, any patients that have anaphylaxis or history of anaphylaxis or reaction to some of the particles inside of the vaccine, then certainly they do not need to receive it. We appreciate all you're doing. We know you're working very hard. I'm so valuable and proud of each and every one of you for volunteering and taking care of an historic event and a pandemic, and using your skill set and your knowledge to help our citizens, and we're greatly appreciative. Thank you.